Good afternoon, everyone, and a very warm welcome to this third episode of Conversations on Commercial Determinants of Health. So, I am Srinidhi, a fellow at the Institute of Public Health, and specifically at the Center for Commercial Determinants of Health within the Institute. So, this is a webinar series that we have been hosting for last couple of months now, and aims to bring together scholars, practitioners, and thought leaders from India and beyond to deliberate the concepts of commercial determinants of health within Indian context. So today's topic of discussion is Gandhi rethinking health in the age of commerce. Before we begin, I would like to recommend a few housekeeping points. Throughout the webinar, I'll request the participants to keep their audio on mute and also, if possible, switch off their video so that we can avoid any potential bandwidth disruptions. And one more request, we would also request the participants to name themselves clearly on Zoom. And if possible, it would also be nice to mention your affiliations or organizations that you represent so that it enhances our interactions, especially given this is an online discussion. Also, today's webinar is being recorded, so we will be able to share you a link in the coming weeks. Finally, we also invite your comments and questions, and please feel free to use the chat box. All your concerns will be addressed through the chat box. And if you have any questions for the speakers, post the discussion, you may type it in. And in case we have time, we'll be taking it during the question and answer session towards the end of the webinar. And for all the participants who will be remaining throughout the webinar, will receive a certificate of participation to their registered email IDs. So to begin the session for today, I'm pleased to introduce our moderator for today, Dr. Upendra Bhojani. Dr. Bhojani holds a master's and PhD in public health. He has about 2 decades of research and teaching experience that spans chronic conditions, tobacco control, health policy and systems research, a lot of research on political economy of health and health inequity within Indian context. He has served as the director at the Institute of Public Health, Bengaluru from 2019 to 2023. He is also currently a senior fellow at the Institute and holds the DBT Wellcome Trust India Alliance Senior Fellowship.
Looking health as a resource for everyday living. And there is, I think, a broad consensus to definitely see health, not just in reference to physical ailments or diseases, but also looking at broadly as a well-being. And when we see health in that way, healthcare sector, as we see and experience it today around us, is really like, Amartya Sen once put it, more of an illness care sector, right? Because we treat people when they are already feeling, not well, etc. So in that way, we are more like mechanic in healthcare sector, where we are repairing sort of bodies. But the real health is created outside of healthcare sector. Conditions in which people are born, they grow up, the kind of nourishment they receive, the kind of education they receive, the kind of work conditions they experience, their social identities, whether it's ethnicity, their gender, their socio-economic status, the caste, class. And these are the factors that substantially determine how healthy people will be. And many of these factors are beyond the reach of or control of a single individual. And we generally refer to these factors as social determinants of health in public health, and see them as very important and fundamental factors for population health. Now, businesses or commercial entities ought to be part of these social determinants of health, but we haven't really emphasized them enough. But in the last couple of decades, what we have seen is a rise in non-communicable diseases, things like hypertension, diabetes, cancers, many of these diseases for which risk factors are, unlike bacteria or viruses, here the risk factors are consumption of, market goods, consumption of tobacco, alcohol, ultra-processed foods, or consumption of fossil fuel linked with kind of air pollution we often experience in Indian cities today. So all of these are not microorganisms, but these are really the commodities which are sold in markets, and to make profits out of these businesses. And that's where we also saw in last maybe couple of decades rise in the businesses and large corporations, to an extent that I think when we think about the 100 largest economies, close to half of them are really the companies and not the sovereign nations. So we also saw this rise of business entities, not in terms of only their economic might, but also the kind of influence they wield on public policies within what we now call more neoclassical kind of capitalist systems that have become dominant across the world. That's where I think public health has also turned its spotlight again on the role of businesses, and what kind of role businesses and commercial interests play in shaping people's health, but also health inequities, which are we popularly call commercial determinants of health. Of course, it's not new that businesses impact people's health. We have seen over years how people get affected, but also people resisting many industrial sort of advancements right from the times of industrialization in Europe. But what we see new relatively is that in last decade or so, we have seen a lot of new development in terms of theorizing how, in what various ways business entities shape people's health. And so we have seen a lot more literature coming up in public health around commercial determinants of health, different kinds of definitions. Of course, this is evolving. So you have, for example, Ilona Kickbush and colleagues who published a paper in Lancet framing commercial determinants of health as those strategies by private sectors which promote products or choices which are detrimental to health. So clearly negative framing. But in the same year, we also saw Kosinska and Osling, who defined commercial determinants of health not necessarily as those health harming products, but more as some sort of innate contradiction or tension between commercial objective of making profits and public health objectives. And we saw this in case of COVID-19 vaccine, for example, supposedly public good, which could not be distributed equally, or at least to those communities who were really in need of it. So there are various ways in which people are sort of looking at this concept of commercial determinants of health. But broadly, as Melissa Mialon summarized, that there are various levels at which commercial factors operate. You can think about products and services which are directly impacting our health, their consumption directly impacting our health. You can also think about activities that businesses do, whether it is about market promotions through marketing, pricing, or is it about the very core business operations, how you produce, manufacture products, your supply chains, how you treat your workers, or even what are now called corporate political activities, right? The kind of CSR, lobbying, etc., that commercial entities do. But also the broader structural factors, how the economic mode of productions are, how we treat labor, capital, what kind of legislative frameworks are in place. All of these can mediate how commercial entities impact people's health. So at Center for Commercial Determinants of Health at IPH Bengaluru, earlier this year, we started this series called Conversations on CDOH, where the aim is to deliberate different aspects of how commercial interest and entities are shaping people's health. This is the third episode in that webinar. But I must share one observation of mine with the evolving literature around CDOH, that much of this literature is also produced by the scholars who are based in high-income country context. Much of the empirical work is also limited to a lot of multinational corporations, again, who are headquartered in so-called global north. And so one of the things we realized is that we also need to explore how, while these frameworks are very useful, how are they relevant and meaningful in our context? Let's say in Indian context, where you may not necessarily always have multinational companies dominating private sector. You may also have a lot of smallholder private sector, the lot of informality in markets. Maybe the relationship between businesses and governments are not always similar. So various reasons we felt it is important to think and contextualize some of these concepts for India. But we also feel that we should highlight how and explore how indigenous norms and thoughts about businesses and health and society can also inform some of these global concepts. So it is in that context that I think today's webinar becomes particularly relevant, because we are going to discuss how Gandhi and his ideas and practice can inform more contemporary public health thinking and practice today. So to do that, we have three amazing scholars, practitioners, but also human beings whom I had a privilege to know in this process of getting them for this webinar, and we'll engage with them. I think the format is that I will go across them individually. They will have time to put out their opening remarks, and maybe I'll go for another short follow-up round before we open it up, where you all can come in with your questions. So feel free to keep typing your questions or remarks or comments in the chat box as we listen from our panelists today. So without any further ado, let me start the engagement, and let me start it from maybe Professor Varadesh Hiregange. Thank you so much, Professor Hiregange, for joining us today. Just to introduce Professor for others' sort of knowledge, Professor Hiregange is a founding director of the Gandhian Centre for Philosophical Arts and Sciences at the Manipal Academy of Higher Education. He's a senior academic in this area and has come from a long-standing experience in journalism, where he worked for several years in some of the big names like the Times of India, the Deccan Herald. He also has steered and provided leadership to some of the other institutes in the area of art, folk performances, including Yakshagana in Udupi. So thank you very much, Professor Hiregange. I think I'll start with you because, I remember attending this talk by Dr. Dr. Kapil from Gadchiroli. I think he was here talking about universal health coverage. I think in the last few decades, the idea of universal health coverage, or UHC, has dominated public health discourse. What we mean by UHC is that how to provide a range of healthcare services to increasing number of population in a way that though they don't have to face financial hardship. And this UHC has become a dominant framework that has informed policy and investment in public health. And when Abhay Bang, whom I was talking about, when Abhay Bang was explaining about UHC, he actually formulated it from the Gandhian principle of Sarvodaya. And he talked about empowering communities so that they can take care of themselves and their health. And that was very interesting for me to know. And so maybe I would request you to maybe elaborate this concept of Sarvodaya, but also maybe cover some of the major threats of Gandhian thought, really giving us a bit of a primer to many of us who are kind of beginner in understanding Gandhi. So over to you, sir. Sir, you will have to unmute so that we can.
Yeah. Thank you, Dr. Upendra Bhojani, for very well introducing the subject of discussion today, rather establishing the context. I'm sure Mohandas Karamchand Gandhi would have liked your introduction, and primarily your emphasis on the need for universal health coverage, public health, and the existing situation today, and the commercial determinants, social determinants, etc. Thank you, first of all, and I also congratulate you on organizing this much needed discussion. Mahatma Gandhi is our conscience, I would put it that way. And at a time when the world is conflict ridden, it is unjust. It has also been facing ecological challenges. In this context, Gandhiji also becomes more and more relevant. His major philosophical basis is Sarvodaya, possibly the most significant essence that emerged from Gandhian life and thought. Sarvodaya, that is the well being of every being and non being, humans and non humans. And you also use the word well being in the context of Amartya Sen's theoretical positions. So, well being of everyone in every way. And that forms the basis of Sarvodaya. And as we know, of course, Gandhi was also much inspired by Ruskin's book, Unto This Last, which he translated and also developed his notion of Sarvodaya in his own way. And we also remember many of Gandhi's remarks, such as we need to rather wipe out every tear from every eye, and whatever we do, it also needs to reach the last human in the ladder. So all these. So in that context, Sarvodaya assumes a lot of significance, and it also goes very well with what we've been discussing today: sustainable development goals set out by the UN. And health, public health is a major component of both Sarvodaya and sustainable development goals. Something uh, that was exceptionally different in case of Gandhi was also his emphasis on health. When he was in South Africa itself, it seems he had written a book on Guide to Health, which he later revises and comes up with another primer, some kind of a primer on health, and titles it as Key to Health. It's about 50 to 60 pages, where he elaborates the components of health. Unlike many other public philosophers, spiritualists, politicians, in the right sense of the word, Gandhi pays much attention on health, and he has also written a primer. And in this, he actually defines what constitutes health. And he defines it as some kind of a body is. Healthy humans are the ones who are free from all diseases. They carry on their normal activities without fatigue. Such humans should be able to walk 10 to 12 miles. Of course, he walked all along his life, and perform ordinary physical labor without getting tired. They should digest ordinary simple food. Their mind and senses need to be in a state of harmony and poise. So he makes an effort to define health, something that could be applicable even today. And of course, he also lays down his broad philosophy of health, something that comes very close to naturopathy. He focuses more on prevention rather than a cure, primarily making use of the Panchabhutas, the earth, the air, the water, the sunshine, so primarily making use of these natural resources available. So something that is very, very unique for Gandhi. At the same time, certainly it was not just individual health that drew his attention. So he wanted healthcare to be available to everyone. He wanted to be healthy, which was his part of his broad philosophy of Sarvodaya. At the same time, there are also other concepts which go well with providing this universal healthcare for everyone. His notion of Swaraj, his notion of Swadeshi, his notion of Satyagraha, all these, in fact, go very well with providing universal healthcare for everyone. So Swaraj, of course, something that addresses one's own being, self-control, from self-control to, of course, Gram Swaraj and democracy. So all these notions emerge from Swaraj. And of course, something Dr. Upendra, you also mentioned. So we also need to develop certain kind of indigenous medical system suitable to this environment. So probably Eurocentrism in healthcare, that has also been part of the problem than the solution. So in that context, Gandhian remark that of course we need to keep our windows open, but at the same time we also need to see that our base, our feet are not blown off. So we need to be rooted in indigenous traditions suitable to this environment, to this soil. So possibly we also need to develop that kind of a medical system suitable to indigenous traditions. So we are also discussing Gandhi and health in the age of commerce. Something very, very specific which Gandhi spoke about with regard to commerce. With regard to commerce, way back in 1922, in Young India, he spoke about 7 sins in 1925 in Young India. Politics without principles, wealth without work, pleasure without conscience, knowledge without character. Then comes commerce without ethics. He considers it to be a sin. Science without humanity, and worship without sacrifice. Of course, these are the 7 sins which he mentions. Something conspicuous, that is commerce without ethics. So when we are discussing health in the age of commerce, from Gandhian philosophical perspective, this becomes singularly significant. And even during his days, possibly this was some kind of a challenge, even though today a problem has probably much aggravated. And he develops this notion of trusteeship. So today we also discuss Gandhian economics. And he lays down certain broad parameters of what could be his ideal economic system. So in that context, he probably borrows from both capitalism and socialism, the virtues of both capitalism and socialism. And he also leaves out the evils, the problems associated with both capitalism and socialism, and develops this notion of trusteeship. So that could be one of the alternatives for managing healthcare in today's world. So when we manage the system, we also consider ourselves as the trustees of the system, and primarily it is in public interest. Whatever we manage, whenever we manage healthcare, we also need to keep in mind that primarily we are managing this in the interest of the public. So the very notion of public health goes very well with this notion of Sarvodaya, something that is an overarching philosophy. And today, there are many contemporary developments which also disrupt this very ideal of Sarvodaya. So our economic system is one which once again perpetuates inequality. Healthcare may not be accessible. It is not accessible for all. At the same time, it is not an ideal world because violence is writ large and conflict has become part of our life. At the same time, climate change is also affecting the healthcare system. So there's also an area of research how climate change is affecting public health. So in this context, once again, there is a need to fall back on Gandhian philosophy. Today, one of the Gandhian remarks, which also forms the basis of all major pro-people, pro-nature struggles, that there is nature provides enough for everybody's need, but not for everybody's greed. Something we need to primarily keep in mind all the time. All these Gandhian remarks could be the basis of our policy, basis of our public health policy. Keeping this philosophy of Sarvodaya, we may make our effort wherever we are. We could be part of the public sector, we could be part of the government, we could be part of the private sector, we could be part of the cooperative sector. So wherever we are, we can make our effort towards providing easily accessible healthcare for everyone, be it during normal days, be it during those days when we face such crisis as the pandemic. We can continue to make our effort to provide accessible, affordable health for everyone, keeping this broad notion of Sarvodaya. These would be my initial remarks. Yeah.
Thank you very much, Professor Hiregange. I think you really did a wonderful job for us to set the scene. That health was not only prominent in Gandhi's thinking, and not only he had a very holistic but very pragmatic definition of what is health. But he also had a lot to say about various aspects, environment, economic system, everything that actually we see today has a direct impact on health. In fact, it's ironic that it's only in last decade or so we started talking about ethical businesses and business responsibility, business and human rights, etc. So now let me turn to our next panelist. Maybe I'll go to Pallavi Varma-Patil. Thank you, Pallavi, for joining us. Just to introduce Pallavi, Pallavi is a co-founder of a very interesting educational initiative called Living Utopias, which basically discusses, the post-growth, post-development kind of alternative visions, mainly from Gandhian perspective. She currently is with ETRI, which is Ashoka Trust for Research in Ecology and Environment, where she is leading the open access digital library initiative, which is aimed at promoting environmental education at school level. And before joining ETRI, she spent nearly a decade with Ajim Premji University, where she was delivering courses around Gandhi and Tagore. So, in fact, she has co-produced a very amazing a book called Notebook on Gandhi, and I hope Srinidhi can share the PDF because it's an amazing introduction to beginner about various aspects of Gandhi's thoughts with some wonderful graphics. I guess her students had developed. So thank you, Pallavi. And I think, Pallavi, I would like you to talk a bit more about the food. And because I think the food and nutrition is so central to public health. In fact, I think one of the most pressing challenge in public health, which we have been facing for years, is the undernutrition. And I think while government is doing a lot, there has been some recent improvements. But if I quote the fifth round of the National Family Health Survey, which was concluded in 2021, it says that more than 30% of children under 5 in India were underweight and were stunted, meaning that they were short to their age. Nearly 20% of children under 5 experienced wasting, which is that they were thin for their height. These are all the critical indicators of undernutrition. And this is, of course, linked to the mother's undernutrition, where I think anemia is still remain one of the major public health challenge among mothers. And I think we are now already talking about dual burden. So while undernutrition is something we are yet to address, we are talking about obesity. Where we see the rise of consumption of ultra-processed foods, rising rates of obesity, and that is again linked with the risk of several other non-communicable diseases. So I think in that way, this food transition is one of the various transitions which are going to challenge public health system. So I know that Gandhi had a lot to say about food, and I think who better than you to help us take us into that world of how he saw food, what kind of experiments he did, and what food meant really in his life and his world. So over to you, Pallavi.
Thank you so much, Upendra. And I'm so glad to present some of the work I've been doing related to Gandhi and food. I engage with Gandhi from the food justice angle. And I was delighted. I mean, I found a very quirky person. I found a scientific person. I found a hilarious person who is also having fun while doing these experiments. So I think last 3-4 years, I started collecting a lot of anecdotes which related to his quirky personality about food. And let me tell you, and I think most of you know already, but Gandhi was obsessed with food. He talked, experimented, wrote, advised about food all his adult life. And he himself called it a hobby of a lifetime. So, one of the scholars once published a paper called Vikram Doctor in a newspaper, Times of India, where Professor Varadesh might have been his editor, I don't know. But he once wrote that, when you look at Gandhi's letters, there's one letter writing a political letter to the viceroy, and the next letter he's telling his followers what to eat. So why? Why was Gandhi's obsession and focus on food? And The way I see it, and many scholars see it who are looking at food systems and alternative food paradigms, we find that the focus on food was as much personal as it was political, as much ecological as it was social. It was as much about nutrition as what Professor Vardesh just said. It was about ethics and justice. And there's a lovely book by Professor Nico Slate, who wrote that you can say that Gandhi ate with the world in his mind. So all his food habits, and there's a lovely piece again by Professor Vinay Lal, who wrote on deep ecology in I think 2001, where he says all Gandhi's food habits, the small meals of nuts and fruits, his regular fasting, his no condiments diet, along with his morning ablutions and other bodily practices, his periodic silences, his morning walks, his brief writings, they were all part of a symphony that was being played out, where every minute act, emotion, or thought was not without its place. It was very considered. So he approached food as a scientist, and I've been fascinated to read, and it's all available open access. You just go to collected. So the way I collected anecdotes were, I used to go to collected works of Mahatma Gandhi and then type food or diet or health, and some real gems would spill out. And I'm going to read out a few of them in today's call as well. All of this is reasoned, carefully reasoned and practiced ideas. I sometimes think that, if he were to make another autobiography, he would say my experiments with food, instead of my experiments with truth, because if a contrarian evidence came to him, he would disregard that practice and say, okay, let's try again. So most people who are interested in Gandhi might know already that each of his ashrams, the menu was very no fuss and frugal. There was raw or boiled food with little or no salt, no spice, no condiments, no ghee, no butter, and certainly not sugar. He has a lot to say about sugar. And there are several humorous accounts exist related to his goat milk tryst. I shared with Upendra one photograph where Gandhi is going to the 1931 conference, and in fact the photograph has two goats. Like, he has shipped the goats from India to London to attend this very serious conference because he has to have his goat milk in time. And there were names, the goats were given names. There are accounts where his ashramites are trying to escape his watchful eye when he's serving them bitter neem chutney. And his 7-year-old granddaughter, Ila Gandhi, she was so fed up of eating boiled pumpkins every day at the ashram. So she went to Gandhi and said that, why don't you rename Sevagram as Kolagram? Because kola in Gujarati meant pumpkin. It's not like everybody was dying to, whatever Gandhi was dissing out to them, they were like dying to accept it. There was a lot of discussion and considered argumentation in favor or against the food. And Gandhi would, of course, try everything first himself before he would implement these rules. So I want to share one published writing in Young India of Gandhi's 1929. I've slightly changed it because for brevity of time, it's slightly written in more detail, but it goes like this. It's a published newspaper of his own, as you know, Young India. And he starts by saying, I have been known as a crank, faddist and a madman. Evidently, the reputation is well deserved. But I propose to introduce to you another crank who introduced me to plunge into a dietetic experiment. Sundaram Gopal Rao of Rajamandri. Gopal Rao runs a nature cure establishment in Rajamandri. And he said to me, to be rid of diseases, it is necessary to do away with fire in the preparation of foods. We must take everything in its raw state, just as animals do. What would you advise me to adopt an entirely raw diet? I asked. Certainly. Why not? I have cured cases through a balanced diet containing germinating seeds, was Gopal Rao's reply. All this is being published in a newspaper. So he writes like this. He's writing his comment and he writes the Gopal Rao's comment. But surely there should be a transition stage. I gently remonstrated. No such stage is necessary, rejoined Gopal Rao. Uncooked food, including uncooked starch and protein, are any day more digestible than cooked. Try it and you will feel all the better for it. Do you take the risk? I ask. Because if I die, then the people will cremate your body along with mine. I take the risk, says Gopal Rao. Okay, then send me your soaked wheat. I commence from today. I commenced the experiment on 9th May. It is therefore now a month when I'm writing these notes. I'm none the worse for the experiment. I have lost over 5 pounds in weight, but my vitality is unimpaired. Fellow faddists should know what I'm doing. And this is what he wrote. I take generally 8 tolas of germinating wheat, 8 tolas of sweet almonds reduced to a paste, 8 tolas of green leaves pounded, 6 sour lemons, and 2 ounces of honey. Wheat is replaced twice or thrice during the week by an equal quantity of germinating gram. And when gram is taken in place of wheat, coconut milk replaces almond paste. The food is divided into 2 parts. First meal at 11 a.m., second at 6:15 p.m. Only thing touched by fire is water. I take in the morning, once more during the day, boiling water, lemon and honey. Wheat and gram germinate in 36 hours. And so on. The water is then strained, and then he goes on to explain how a sprouting happens. Now he writes, I published the facts of this experiment because I attach the greatest importance to it. If it succeeds, it enables men and women to make revolutionary changes in their mode of living. It frees women from drudgery, which brings no happiness, but which brings disease in its train. The ethical value of uncooked food is incomparable. Economically, this food has possibilities which no cooked food can have. But let no one blindly copy this experiment. I do not claim success for it yet. I'm moving cautiously. Facts are published so I can compare notes with fellow food reformers. So I'll stop here and I'll come back to other anecdotes, but just wanted to show you that it's a very scientific Gandhi, it's a very scientific temperament Gandhi that is experimenting with food and also crossing the dots of what Professor Vardesh was saying, the Swaraj and the Sarvodaya and the Swadeshi in his mind while doing a simple experiment with raw food. So over to you, Upendra, and I'm eager to listen to Yogesh as well.
Oh, wow, what a fascinating man, eh? And so nice of you to talk about this in such a way that we really felt and experienced those kind of anecdotes that you shared with us. And yeah, thanks for highlighting that food was much more than just a diet for him. And a person had his particularities, but he was also a very pragmatic person who kept sort of learning and changing. So wonderful. We should have time to come back to you. And let me now move to our next speaker, Dr. Yogesh Kalkonde. Thank you, Yogesh, for joining. And I have known him for some time now. I think he comes closer to the health field, of course. Dr. Yogesh was trained in India. He's a public health researcher and a neurologist. He got trained in India, then later he got trained in the United States in neurology, but also in clinical research and public health research. And then he decided to return to India, mainly to work with rural and Adivasi tribal communities. Because these are the communities who had very limited access to healthcare. He currently works with the Sangwari, the People's Association for Equity and Justice, which is in rural Chhattisgarh, where he is spearheading efforts at how to strengthen public, meaning the government healthcare system in Chhattisgarh. And before that, he worked for many years at the Search, which is in Gadchiroli in rural Maharashtra, where he led more of a chronic and non-communicable diseases research program. So wonderful and so nice of you, Yogesh, to make time for this webinar. I think we already in the earlier two speakers hinted at sort of the broad picture, but also coming and making some links with health directly. But now that you are healthcare practitioners and working in rural India, would love to see how you see, how Gandhi's ideas can tell us about health. And I believe, your choosing to come back and work in rural India itself, in part, was inspired by Gandhi. So eager to listen to you. Over to you, Yogesh.
Thank you, Upen. First of all, I would like to thank IPH for hosting this very interesting session. I would comment first on why this is ideologically important for me. I'm not a person who believes too much in ideology. I'm a very scientific person to the extent I am. But often the discourse in public health is rights based. and it is left-leaning, and it is largely driven by Western, thought, Western intellectualism. And so I'm really glad that you brought in Gandhi, who is, in a sense, is a responsibility-based, who takes the responsibility-based approach rather than so much rights-based approach. So it's important that we hear both sides. It's not just that we hear, only rights-based approach. It's also important to hear a discourse which is based on responsibility. Secondly, it is why it becomes even more pertinent. So, Gandhi has focused, one major aspect is on hygiene and other aspect is on food and nutrition and lifestyle. So it was relevant when he was there, when infections were the leading or the major marauders as far as human mortality is concerned. But now we have the pendulum is switched now. We know that now 65% of all deaths in India occur because of chronic non-communicable diseases, which are largely driven by lifestyle. And as far as science goes, we know that up to 80% of these chronic non-communicable diseases are preventable, and a large part of it is driven by lifestyle. And so, the way we look at it to this lifestyle change, we are all struggling how to sort of adjust with it. And, where Pallavi's comments come in, starting from food and the way we live. So, even, Gandhi becomes even more important. And as a researcher working on chronic non-communicable diseases, what he speaks of becomes way, way, way relevant today. And especially his concept of nutrition and focus on nutrition. So the other thing, what Gandhi asks is some very fundamental questions, which are deceptively simple. So we all talk about good health, and we have definition of health by WHO, but we never ask health for what. And so Gandhi asked the question, health for what? And by doing so, he sort of expands the way of thinking about health way beyond the human body. And then in that comes the society, the culture, the ethical values. So everything gets encompassed in his world vision of health. So when he asked, why do you need health? And this is from Key to Health, the book that he has written between 1942 to 44. He defines it as the purpose of health to exercise self-restraint and dedicate ourselves to the service of whole world. So that's his philosophy. So why you have to keep your body healthy is because you have to serve the whole world. And so then you start getting more clarity as to why he's so obsessed with what Pallavi has just described in doing so. The other question is, when he talks about health, it's just not this so sometimes described as fadism, food fadisms, but it is way deeper, way deeper. And for him, he thinks that the way the lifestyle is evolving is an issue of civilization. And the way he thinks that this is the way we are changing, the capitalism is a civilizational issue for Indians. So that is also important, and this is he has elaborated this in Hind Swaraj, the key book that he wrote in 1909 when he was traveling from London to South Africa. And until his last days, he has not largely changed on what his views were. And so, if one wants to understand Gandhi, the key book is to read Hind Swaraj. And he had made some tweaks, but again, the philosophical underpinning of all his thought comes from that book. And so he believes that and so he believes that whatever we do in terms, however we think of health, we shouldn't think it from a Western civilizational perspective. And this is probably based on what he see in 1909 in England. And what England in 1909 looked like were factories and factories employing whole families, including women and children. They were all overworked. They were filth. There were diseases. And it was a very sickly view. And so the other thing he saw was, the greed which was driving industrialization. So he realized that, this is not the civilization that someone should take pride in. Again, based on what he saw there. And on the contrary, he thought that the civilization that is non-competitive, which is much more cooperative, which he thought the Indian civilization was more cooperative than competitive. And so he thought that we have to consider that in mind, and we should not blindly follow the machinery. He was not, some people think that Gandhi was anti-machine. He was not at all anti-machine. So in fact, at one place he has said that in Hind Swaraj, he mentions that the most intricate machine is the human body. So he understands that machines are important, but he says that man should not be slave of machines. And he also focuses on individuality. He says that a machine should not make a human being small, or it should not let the individual lose its individuality. So that is something that he was very concerned about. And he thinks that, in order to maintain this machine, the human body, it needs to move, it needs to use hands, it needs to use feet, and anything that would reduce the use of hands and feet for him was a no-no. And in general, he was not very very enamored by what doctors did or what hospitals did. And he was actually anti-doctors in a sense, and not only doctors, he was also against lawyers. He himself was a lawyer, and he was very anti-lawyer, at that as well. So he believes that by having doctors, people start feeling it's safe to indulge. And one of the things that he sees of ill health is indulgence. So one of the key risk factors that he has identified for ill health is indulgence, and doctors make it possible for patients to indulge. And so he says that he actually severely critiques hospitals as places to propagate sin. So that's how he's looking at it from the whole thing. So instead of people taking care of their own health and using preventive health, they are getting themselves sick and then going to the doctors. So actually, you are transferring power from your own hand to the hands of doctors. And same analogy applies to the lawyers. That instead of solving your own issues, you are going to the lawyers and you're making them rich. Same thing with doctors, you're making them rich. So he says doctors are needed, lawyers are needed, but their importance should be limited in the society. So now, he has, he asks why you need health. So, and then that brings up to the civilizational question. And then he comes to, he's a pragmatic man. So he just doesn't give theory. He also gives so what should you do to sort of improve your health? And that's also embodied in his larger philosophy of life. And he draws heavily on Jain and Buddhist and Hindu sort of ethics on that, and he adds some values. So his simple, principles were, 12 vows. So he is heavily sort of, motivated or influenced by the vow, the concept of vows, the vratas that we call. And as you are aware, the Jainism has 5 vratas, and he adds some more. So in the prayers that he had, in Gandhian ashrams is you recite these 11 vows. And what are those 11 vows? So I'll just sort of list them here. So first thing, it starts at ahimsa. So all we know, ahimsa is non-violence. Then satya, truth. Then asteya meaning non-stealing. Then brahmacharya, meaning celibacy. Then asangraha, meaning no interest in possessions. Then sharirashrama, meaning physical work. Which he considered very important, which he added to the earlier Jain sort of vratas. Aswada, meaning control over your palate. Then bhayavarjanam, so freedom from fear. And in addition, then he says, samanatva, so equality in respect of religions. Swadeshi, meaning self-reliance. And sparsha bhavana, so non-belief in untouchability. So these are his 12 12 vows. And through these 12 vows, he, if you follow all these 12 vows, he believes that it will create a world which is much more just. And in that, health will automatically be taken care of. So all these vrats, I mean, if you practice all those vrats, you can, imagine your health will be good, although people will abhor if he says aswada. You can't enjoy the flavors that you have. And then, so many people would blame this as too ascetic, too impractical. But in a sense, he had that prescription ready. And so, the key thing is this is how it flows. So, health for what? Second, it's a civilizational issue as to what civilizational principles or values or ethics you borrow, in which the health sort of the human body sort of performs, and then the 12 vows that come forward and that give you sort of prescription as to how you would go to it. And a lot of, I mean, if you start understanding this worldview, a lot of what it looks like food faddism would start making sense. And as I said, he was a very sort of, he was a very haughty man. So once he decides on something, he will not easily give up until you find, until someone gives him sort of more strong, sort of convincing evidence, which Pallavi also mentioned. And so that's, that forms the core of his health philosophy and health prescription. And coming from the commercial determinants of health, on which Dr. Varadesh already, dealt on, is he doesn't see world as conflict. So typically our Western, view is that we subscribe to is there's someone who's oppressor and someone who's oppressed. Gandhi or Vinoba or other Gandhian thinkers see that in long term this would lead to violence. these constant conflicts will lead to violence. So that's why he comes out with this beautiful philosophy called Sarvodaya. I mean, you can imagine the world, when we coined the term, in the world, the dominant force was capitalism and socialism, communism that were there. And in that time, coming out, coining such a word in itself, needs a lot of deep thinking. And it's a simple, 4-letter word, and it's a beautiful word, which came out there. And he understands that, by constantly creating conflicts, we are not going to solve these issues. So he believes, pragmatically, he believes that, we need industrialists, we need industry, we need commerce, but it has to follow the principle of Sarvodaya. So from a larger perspective, the health is also seen in the context of Sarvodaya. So I'll stop at that.
Wonderful, Dr. Yogesh, for making these remarks. I think, health for what? Illness as indulgence. I think when I hear those vows, it looks like this is what today's behavioral change public health campaigns want to do. So he's ever more relevant. I mean, if you look at some of the contemporary critique in public health journals of how capitalism impact health, or what are the problems with medically dominated healthcare systems, you see the same thing. What I think you are saying, Gandhi sort of anticipated or said in his times. So yeah, it's eerie to listen to this, and ever more relevant as the non-communicable diseases epidemic rise. So wonderful. I think we are doing okay on time. So I would like to go through one short round of follow-up with all three of you. But maybe this time we'll have to keep it brief so that we can still have time for some questions. And maybe I'll go in the same order. So I'll come to you, Professor Hiregange. And while you gave us a wonderful primer, really, of various ideas, maybe I'd like you to pick up on one or two. And I was just wondering, in the current public health context, there's a lot of debate around decolonizing global health. And with ongoing wars, there is so much being discussed, because either you have, and particularly how some of the nations are responding to these ongoing wars. We have seen, for example, USA pulling itself out of WHO, dismantling USAID. But it's not just US. I think we have also seen cuts coming to health research and health programs from various European countries as the defense budgets are going up. And this has given a new fillip to the ongoing debate of decolonizing global health, because there are folks who are really worried because they feel this is terribly impacting health of many communities who had to rely on these aid. At the same time, there are others who feel that this is a part of a larger kind of power realignment which is going to happen, and might correct to an extent the unfair kind of power relations. In these times, I can't think of other person than Gandhi when it comes to thinking about peace. And I was wondering whether you, because I know you take a lot of interest lately in that area. So if you want to tell briefly a little more about how Gandhi thought about peace and his ideas around that. Sir, again, you'll have to unmute so that... Great.
Yeah. Once again, it was lovely listening to you, Dr. Upendra, and Madam Pallavi and Dr. Yogesh. Once again, Sarvodaya is such a philosophy that can also always enlighten us on all contemporary issues. And the notions you just now mentioned, be it decolonization or the notion of world peace, they also, of course, figure as part of Sarvodaya philosophy. And health, as I mentioned, is one key important component, but all the human development indices we mention, all the goals which we mention in sustainable development goals, they are part of Sarvodaya. So making this world without any unemployment, without poverty, providing everyone with education, employment, health, nutrition, so also freedom and happiness. Everything could be brought under this broad notion of Sarvodaya. And Colonization probably has also adversely affected us in the sense that it has also affected our medical practices. As a result of that, the cost, the medical expenditure has gone up considerably. By practicing indigenous systems, or rather um, adopting and adapting Gandhian approach to health, we can certainly bring down the cost of medical expenditure. We may certainly bring it down. At the same time, we can also provide better medical service, more suitable to the people in this part of the world. And secondly, with regard to peace, which has been disrupted by the wars elsewhere, and of course near the border and in different parts of the country. So today, even in peace research, there has been much conceptualization and theorization. And once again, in peace research, Gandhi prominently figures. There is a whole notion of peace pyramid, which also speaks about different layers in achieving world peace. And it also talks about different other constituents of peace, and health is also one of the important components of peace, both mental and physical health. At the same time, of course, education, employment, then of course environmental peace, gender peace. So all these are part of this peace pyramid. Once again, it reminds us of the ideal of Sarvodaya. So here, once again, there is every reason that we need to fall back on Gandhi. But something I thought I must point out, when we speak in terms of various parameters of peace, global health, of Sarvodaya, there could be certain contradictions within which we need to address. When we say that we need to achieve global public health, healthy global public health, our own practices, our own economic model, which focuses more and more on development, that itself can result in many problems. The capitalist model, which is actually part of our public life, even for that matter, the socialist model, which emphasizes on a certain kind of industrialization, these also have been part of the problem. And with Gandhian notion of Sarvodaya, we should be able to address problems arising out of these economic systems. And hence, I would argue that there is also a need for an alternative economics, especially when we discuss health in the age of commerce. There is also a need for alternative economics, alternative economic system based on Sarvodaya. I would also put it as some kind of ecosophical economics. Ecosophical economics, incidentally, the term ecosophy originating from Norwegian philosopher Arne Naess, whose postgraduate dissertation was on Mahatma Gandhi, incidentally. So that once again establishes that connection between Gandhi and ecosophy, and the first, probably the first theorist of ecosophy, that is Arne Naess. So earlier also, of course, the much cited book is The Small is Beautiful of Schumacher, the German economist, which models economic theory on Gandhian and Buddhist thought. So now, once again, I think it is high time we speak in terms of alternative Gandhian ecosophical economics, and our policies need to be shaped in terms of this alternative economics, because our growth model, our development model, which is highly capital intensive, at the same time technology driven, that is also resulting in problems connected with public health. We also need to identify this part of our endeavor, because we keep speaking in terms of the problem, and we don't really get at its root. Probably Gandhian approach was trying to address the root of the problem, root of our illness.
Right.
And hence he was also rather speaking in terms of prevention being better than cure. He was focusing on healthy practices, considering body itself as a machine, and how Panchabhuta, the harmony among the Panchabhutas within the body, be it water, be it matter. So that establishes certain kind of health, at the same time taking care of mind, the mental poise. So I would once again argue that there is an urgent need that we restructure our economic policy, our economy itself, on Gandhian philosophy, and I would also term it as, in certain sense, as ecosophical economics. So
Thank
that's my
you,
response.
sir. I think this is clearly a call for public health researchers to engage much more on structural causes of ill health, and I think that's where we cannot escape the very economic order or the system which can and is creating. And of course, we need to engage more with Sarvodaya as a principle to see how we can inform our inquiries. So thank you. I'll turn to Pallavi. I think Pallavi, Professor Hiregange has made a good rationale to attend your Living Utopia program for many of us to understand the post-growth and post-development kind of alternatives. I already seen comments, some of the participants asking for such alternative, and this is not usual for public health people, many of who come from medical side, and our clinical trainings are too blinded to just learning medicine and biology and stuff like that. So thank you. I think you all are opening up new ways of thinking. Pallavi, I think I myself is struggling to reduce sugar in my diet, like Yogesh was saying. So while it's wonderful to see how Gandhi was a very practical scientist in experimenting with food, I wonder how it was seen by those who joined those experiments. I'm really struggling through in taking this responsibility of my own diet, and I see many around me struggling in the same way around changing food habits. So
Upendra, I want to come back to your original question that you also gave to Professor Varadesh. The thing is that I have been grappling with this idea of peace and food justice, and in India a few years ago, lynchings had started because of a certain kind of food intake by a certain community, and there was food unites, but it also divides, especially in so many fault lines in India. And how do you teach Gandhi in times like these? And there's a very special book called Gandhi, His Gift of the Fight by Jahangir Patel and Marjorie Sykes. And there was a lovely anecdote that I will use my time to just say that, because it gave us, I think Professor Varadesh started by saying that Gandhi is our conscience, right? It gave us a lot of meat for thought, pardon the pun, because this anecdote is about meat. And this is about May 1944. Gandhi is released from the Aga Khan Palace near Pune. And he's weak, unwell, and lonely. And he has lost his wife, Kasturba, and Mahadev Desai, who was his companion for so many years. He's lost him as well. And his doctor, Dr. Gilder, suggests Gandhi rests and heals at Jahangir Patel's Juhu home. Miraben is with him, and one morning she's very visibly upset, and she comes to Jahangir in a little bit of anger and says, Bapu won't be able to eat his breakfast. Someone has put meat into the fridge where his food was. How could you allow such a thing? Jahangir Patel goes to investigate and indeed finds a piece of raw meat lying alongside the fruit and other things intended for Gandhi's meal. He immediately calls his cook Ali. I got it for the dogs, said Ali. I'll take it away at once. No, leave it for now, Jahangir replied, and went off to call Gandhi himself. I want to show you something, he said. Gandhi came along with Miraben. Look, Bapu, she said, when the fridge was open. There is raw meat next to your grapes. Jahangir should have known better. I'm sorry, said Jahangir. I did not think of speaking to Ali. I did not realize that this would happen. Don't apologize, said Gandhi at once. You and Ali have done nothing wrong as far as I can see. As he spoke, he took a few grapes from the fridge and ate them on the spot. Ali, he said, please go on doing whatever you usually do. Don't change anything because of me. Then he turns to Miraben. We are guests in our friend's house, and it would not be right for us to impose our ideas upon him or upon anyone. People whose custom is to eat meat should not stop doing so simply because I am present. There is something else in this fridge for you to see, said Jahangir, showing Gandhi 2 bottles of wine. You know that I don't drink now, but I keep them as a courtesy to my guests who will certainly offer me such drinks when I visit their homes. I don't believe in hiding these things, but I will put them away if you wish it while you are here. Let them stay where they are, replied Gandhi. If you serve wine to guests or drink it yourself, that is entirely your affair. If you were to ask my advice, I would say, please avoid it. But I would rather you were a drinker, even a heavy drinker, than there should be any deceit in the matter. Some of our friends do drink, I know, even though they try to hide it from me. I'm sorry about that. I wish they would admit it openly. Jahangir could not resist a bit of teasing. He picked one of the bottles and says, why don't you try this grape juice? It might be even better for your health than goat's milk. And Gandhi laughed, saying, I'll stick to goat's milk. I'm saying this anecdote, and as I told this to my classroom in the university as well, because there are so many ideas and beliefs that we have about Gandhi, that he was very dogmatic, that he was, very insistent that this is my view of vegetarianism. And there is always an evidence that people use his name to say, like, look, vegetarianism is better. He has also practiced it. But there was this peculiarity in his personality, which was about not proposing and not imposing, and this danger of compulsion of views that India is seeing, especially around food habits and diets. In that sense, also for peaceful communities of sharing and caring to thrive, it is also important to remember that tolerance was a key virtue of this particular person. Thank you.
Wow, thank you so much for sharing that anecdote. And I feel like we can just keep listening to you over these anecdotes. I think what you shared directly spoke to what Smita Todkar had put a question in the chat, where she was also wondering how Gandhi's advocacy for vegetarianism can be, shared and taught today. But I think your anecdote really clarified very important aspects of how he dealt with it. Maybe the quick input from Yogesh. I think, Yogesh, one of the criticism of Gandhi I have heard to an extent is about his views on technology. And I think Today, technology is kind of driving healthcare, so to say. I think last time we met, of course, we met in Bangalore, but before that, we met in Delhi, and that was in a summit where some of the cutting edge tech startups in health were being showcased. I think it's nearly impossible. Every new challenge and writing around health you see, technology will be there. So I wonder. Because I think there are people, I was listening to V.S. Naipaul, some old interview where he was saying how Gandhi's ideas about technology are historical, probably impedes progress. You are also situated in rural India now, and I wonder how you look at this, because I've seen you engaging with some of these tech entrepreneurs and new kinds of products. So would love to listen from you how you see this technology and healthcare today.
Yeah. So, thank you. Thank you for that important question. So one thing, when you work in rural tribal areas, you start seeing, excessive deaths and preventable mortality. So as a practitioner on the field level, you are in a haste. How can I, prevent these deaths? How can I, avoid these deaths? And as a doctor, that's your natural sort of instinct. Gandhi would probably go to its root cause and figure out maybe it's the unhygiene, lack of hygiene that led to deaths, or maybe inappropriate food that led to death. And so as we become too jumpy, and we find low hanging fruits to reduce those deaths, because as inside it hurts to see preventable death. So that's one aspect of it. And second, this is something kind of. It gets a little slippery when to see, even for Gandhi, in Hind Swaraj, he's asked question that you're okay with charkha, but how about singer machines? At that time, the singer sewing machine came, and the person who asked these questions in Hind Swaraj asked him, so how do you define a line where you are okay with technology? And Gandhi's answer was same that I provided previously. As long as the individuality is maintained and the person is not slave to that technology, there you could stop. And again, as I said, even and his views kept on changing. So oftentimes the challenge with Gandhi is people pick and choose views to suit their own ideological or arguments to make. And Gandhi himself has very clearly said that if you see, and this is written in almost all of his books, that if you see conflict between what I said today and what I said before, take the one that I have said later. And this is a clear disclaimer that he mentions in every book. And so, because he says that my ideas also change, and that, as Pallavi has mentioned, that it shows a adaptable person who thinks through and ready to change his idea against, again, a caricature of Gandhi being very dogmatic, which he also was. But again, as I said, it keeps on changing. So I guess, as far as technology to improve certain things, that Gandhi would not be against. So I was thinking, like, what technology Gandhi would be okay with. So something that increases maybe physical activity. So if there is an app to increase physical activity, maybe Gandhi would be okay with it. If there is an app to increase mindfulness, maybe Gandhi would be okay with it, because it fits in with his larger values. But if there would be machines that reduce physical activity, so he was also against the ideas of cars and aeroplanes. And at one point he mentions, what's the need to travel 400 kilometers or miles in a day? That's too much. The human body should only explore what he can walk through with his own legs. And so and so what happens is, one of the challenges you need to understand, that technology has made so much progress in the last 50 years that the rate of change has drastically increased. So, usually before, the generations before, I always keep with that, maybe 50 years ago, a grandfather, a father, and a son could just sit and discuss the same topic, which was farming or something that way. Today, a grandfather, son, and a grandson cannot sit and discuss together, because so many things have changed. And so, in this technological world, and we all get fascinated. I mean, our whole upbringing is so technology driven that we are not allowed to see a contrary view. Now we are talking about giving a break to social media, or giving a break to use of gadgets. That will come. Maybe those will be Gandhiji's upwas. So I'll have a upwas from a fast from taking my mobile phone. So I'll not have, like he had the episodes where he would go into silence for 2 days, and so maybe I would not use mobile phone for 2 days, and the whole idea of not using mobile phone for 2 days is increasing my heart rate. So that's the kind of world that we live in. So So Gandhi had a very clear answer to that, if you're becoming slave of that gadget, then make sure that you're not slave. And people are realizing, it's not like, we are not putting Gandhi's name to it, but people are realizing, and there are movements away from these gadgets. The question becomes how strong they are. So there are movements to push technology and gadgets and sell it or oversell it. And the industry is really good at it, better than people who take it. And so we had to, unless this contrary voice emerges and becomes gradually more and more powerful, and it will happen. I mean, and it's interesting that it's again driven by the West, because they have seen the bad effects. So we are yet to enter a very dark age. The West has already gone through the bad age, and now you talk of mindfulness. The maximum lectures are coming from the West. We have forgotten that mindfulness was something that was developed in this land. But that's also a cycle, and how civilizations move at different speed. So that is something that I think we need to understand. The other aspect that I also wanted to touch is when we talk of structural determinants of health, it makes person feel very incapacitated, because these are structures, these are beyond my control, and I cannot do anything about it. And so Gandhi's answer to that was the concept of Swaraj, and often we consider Swaraj as freedom, swatantra. That's not Swaraj. Swaraj is a very old word. I mean, the earliest word, use of that word I found in some Rigvedic texts. So Swaraj is a very old word that Gandhiji uses, and Swaraj stands for control on yourself. Swa is self, and Raj is control. So you control yourself. So when we often talk about governments forming policies or addressing structural determinants, we often forget that the individual also has a lot of power. And I think that the key learning from Gandhi is these larger structures will emerge the way they are, but you need to take responsibility of your own health and a lot of things around you. Taking discourses only to structural, larger societal, political context makes the human being sound very small, and a person might feel that I cannot do anything. And I used to work on tobacco in Gadchiroli, and people would say, why are you coming to us? Go to the tobacco companies and ban them. That's the easier approach. So so it pulls the whole sort of onus back on and makes the person seem very small. So Gandhi is against that idea. He says that you can control yourself. The concept of Swaraj is very empowering that way. You can control yourself. You'll have to figure out why. I mean, if I'm unable to control sugar, I need to ask a larger question that what is the need for my health to be good, so that I can put some restrictions on myself. So that's a larger concept, and I think both of them are sort of if you take the Swaraj concept and then compare it vis-a-vis the technology and see if I'm losing my Swaraj because of this technology, then that becomes a red line that probably Gandhi would say don't cross. Over.
Wonderful. Thank you, Yogesh. I think we have reached to the end of the time we had, but I already saw that the few questions or comments that were there have been addressed in the way you made interventions, some of you. But maybe let me pick just one more question and put it to all of you with any quick answers that you might have. I think I'll pick two because they both are overlapping. I think Satyanarayana is asking that Gandhiji was not fundamentally against the idea of private property or enterprise, although he did question the immorality of accumulation or greed. Considering the composition or oppression of the current private sector, can we aspire for a more responsible private sector, driven by ideals of service and trusteeship? And I think there was another one which is very similar, which says that Gandhi's proposed alternative to capitalism, the doctrine of trusteeship, relies on the voluntary moral transformation of the wealthy, who are expected to act as trustee for society's surplus wealth. Isn't this a little impractical, as it depends on a change in human nature rather than on structural regulations? I feel the idea of voluntary renunciation of wealth by capitalists seem overly idealized. So maybe there are some common threads if you want to have any quick response, any of you, three of you, because I wonder we may not have time to go through the last kind of summary remarks. And those who can still be around can be around for a few more minutes as we wind this up. So yeah, any of you from the panelists who want to have any quick reaction to these kind of questions?
Yeah, I would like to. Actually, Gandhian philosophy has these two dimensions. The Sarvodaya philosophy of Sarvodaya itself has two dimensions. When he was asked to comment on socialism, he responds, of course, it's a very fine philosophy, but it has to begin with oneself. Swaraj. It has to begin with oneself. Then, of course, that may be extended to others and other walks of life. At the same time, he also writes a book sometime in early 40s about constructive programs. So he was, of course, all the time engaged in freedom struggle on the one hand, but at the same time, he was also wanting complete socio-economic transformation of the country. Otherwise, for him, freedom did not have any meaning. So in constructive programs, of course, he brings up all these issues, of course, issues of removal of untouchability, Hindu-Muslim unity, health and hygiene, education, employment. So all these issues are brought up. So with regard to, of course, he also comes up with his own economics, comes up with the notion of trusteeship, alternative lifestyle, which can also rather set right our own lifestyle disorders, all these. At the same time, with regard, his views with regard to private property, trusteeship, capitalism, socialism. So all these, in a sense, yes, these are the ideals one needs to strive for. One needs to strive for, and it is an ongoing process. So not that everything was achieved during his own time. So it is a broader sociological process that has to go on. But I think we need to remember one of his remarks, something that can really give us confidence. That is to think that something that was not achieved earlier will not be achieved in future. I'm just taking the essence of his remark. If something that was not achieved earlier will not be, to believe that will not be achieved in future is an affront, is an insult to human intelligence and human ingenuity. So probably this kind of a conversation itself is part of such a process of rather taking a couple of steps towards that blueprint of Sarvodaya, which is also free from all kinds of violence, misery, and all crisis. I think that itself is a step. This itself is a step towards realizing that worthy dream world of Sarvodaya.
Thank you. So some more hope and optimism, and I hope more such conversations. Pallavi, if you have any quick remarks.
Yeah, I quickly wanted to add, something that Yogesh was saying about the civilizational value framework. And agar hum lens badal dein, if we change the framework, and Gandhi has used industrialism as one word in Hind Swaraj once, and this Udyogvad, and he considered both socialism and capitalism as, I'm putting it crudely, but as children of Udyogvad, of industrialism. So if you look at the civilizational lens and you understand that it has a value system of more and more exploitation, and in which all of us, as part of civil society or as nation state or as it's educational, it has its different spheres of civilization. If we look at it from an industrialism lens, then it makes sense. And the purpose is to do a certain kind of economic model that Professor Varadesh is saying. Driven by that, the nation state behaves in a certain way, society behaves in a certain way, our education behaves in a certain way. But if, and Gandhi, and even before Gandhi, Tagore as well, is exploring alternatives to industrialism. To come back to the question, can we think of alternatives? I say that if you change the civilizational lens, yes, there will be an alternative business model that is believing in collaboration, that is believing in equity, it's believing in justice, and a value system changes. So it's always useful, and Yogesh in his talk is reminding us that keep going back for what? You can have a wonderful business for what? You can have a wonderful health practice for what? So ये question अगर सामने रख लें, that is a very useful framing to understand. Amazing education for what? Because I work in the space of education, I'm constantly asking excellent pedagogies, but for what? What is your purpose? And if that purpose ठीक कर लिया, तो then things will, with a certain value system, things align. That's it.
Wonderful. Thank you.
One
Yogesh, yes.
One quick comment, if I can. So, we all are, restless to make a change, and the change happens at individual level and systems level, and nobody has right answer to that. So, largely Indian philosophy believed in, individual change, while the Western concept that we got, right starting from the communism is, change the system and people will change. So I guess there is no right answer. We'll have to work on both fronts. So, changing industrialists, again, as Professor Hiregange said, that, change is possible. And maybe we'll have to work on education of industrialists or, businessmen to think, but at least bring in that lens so that, just the greed is good as a principle driving industry has to be challenged. Over.
Wonderful. Thank you so much. I fear that that's all the time we had. In fact, thank you for staying back for 10 more minutes. My profuse apologies for the disruption that happened at the beginning. In fact, I was shivering. I thought, what is happening? And then I think three of you and listening to you brought a lot more calm to me. Thank you so much. I think my deep respect and thanks to all three of you. You gave us a very gentle introduction to Gandhi's ideas and the world. And I hope, and I saw in the comments that so many of participants felt very interesting. I find this very stimulating, and we hope that we can continue to deliberate over this. We will edit this video and put this out in public domain so many more participants could join. I understood that we could not admit some of the participants after that confusion. Also, sorry if we could not take many questions. There were some more comments and questions on the chat box. But based on the consent from speakers, we can share their email so that there can also be a direct reach out by interested participants to the speakers. So thanks again on behalf of IPH, on behalf of Center for Commercial Determinants of Health. And we look forward to keep engaging with three of you. Thank you to all the participants for remaining with us throughout. And please take care till we meet again in hopefully February next year with another episode of Conversations on CDOH. So thank you very much.
Thank you.
Thank you. Thank you, Upen. Thank you, IPH. Thank you, everyone.
Thank you.